During the presentation, all participants will be in listen-only mode. Should you wish to ask a question during the presentation, please use the chat feature located in the lower left-hand corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Tuesday, February 14th, 2017. I would now like to turn the conference over to Dain, Executive Director of the NCD Alliance. Please go ahead.
Good afternoon or good morning, everybody, and welcome to the NCD Alliance webinar on Tuesday, the 14th of February in 2017. Next slide, please. We have a very full agenda for you today with a number of NCD Alliance speakers, as well as we have a guest speaker. So from the team, we have Alena, Matzke, and Priya Kanayson, and our guest speaker for this month is Fiona, who is the immediate past president of ISPA, the International Society for Physical Activity and Health, as well as now just recently joined the World Health Organization as the Program Manager for Surveillance and Population-Based Prevention of NCDs. Next slide, please. So the agenda for today is the following. We're going to first start with an update from Fiona on progress on global physical activity policy, particularly focusing on the ISPA conference at the end of last year and the recent discussions at the WHO Executive Board around physical activity. Following that, Alena Matzke from the NCD Alliance will walk us through the full agenda and outcomes of the WHO Executive Board that took place at the end of January in Geneva. And then following that, we'll have two updates from Priya in terms of UN updates. Number one will be around preparations for the 2018 UN high-level meeting on NCDs, the third UN high-level meeting that we're going to be focusing on for NCDs, so a big opportunity for advocacy there. And then finally, Priya will walk us through the UN Commission on the Status of Women that's coming up in March, and then give you an update on the UN High-Level Political Forum for Sustainable Development that will be taking place in July in New York, and a big opportunity for reviewing of progress on the SDGs and a big focus on health and obviously NCDs within that. So with no further ado, let me pass over to our guest speaker, Fiona from Switzerland at WHO, to talk us through the physical activity policy updates. Fiona, over to you.
Well, thank you very much, and good morning and good evening and everything in between to the listeners who are joining this webinar. It's a great pleasure to have the invitation and be able to accept. Indeed, this is my first presentation in my new position here at WHO. And it's a great pleasure to be able to take up the agenda of physical activity and the ambition to scale up global action to increase physical activity, and to speak to you for the next 8 to 10 minutes on the Bangkok Declaration and a forthcoming agenda that follows the Executive Board that took place here at World Health Organization in January. So I'd like to start at the end so I get across my main messages. You can return to this slide. But of course, for many listeners on this call, physical activity's place within the NCD agenda is well known, but it is an important starting point, one which we must never forget to emphasize and reinforce. The second main point here is that the Bangkok Declaration, which I'll outline in this presentation, provides a significant platform for promoting and investment in physical activity, as it can link across to 8 of the Sustainable Development Goals, and the Agenda 2030 is really shaping our investment and programs going forward. The third point is that it outlines very usefully for all of those on the listeners and many of the stakeholders in this field, whether that's government, international donors, national governments, and of course academics and the non-government sector, of what are the barriers to scaling up. And the Bangkok Declaration outlines how we can have a coordinated, collaborative approach to responding. My last point, which I'll speak to, will be about the EB, the Executive Board agenda, which has now presented itself with a proposal and opportunity to develop a global action plan. So with that, the role of physical activity, a cornerstone to preventing non-communicable disease. Within the political declaration, the global action plan at WHO, a set of targets, one of them very specific to reducing physical inactivity by 10% by 2025. And of course the burden that we know, and of course the cost. But let's not forget, though not mentioned on this slide, of course, is the co-benefits and the benefits to mental health, social health, as well as the wider agendas of transport, education, and other community benefits. Moving to the Bangkok Declaration, many on this call, but not all, maybe are already familiar with this. And this is a slide where I'm going to tell you what it is, where it came from, why we did it, and how we did it, all on one slide. But first of all, what is it? It's an agenda-setting advocacy tool setting out global action for physical activity, a collaborative template which we can work from and towards over the next years to come towards reaching the targets. It was developed at the 6th ISPA Congress. ISPA is the International Society for Physical Activity and Health, held and hosted in Bangkok in Thailand. It's the Congress consensus statement from a large delegation representing 82 countries, forming a document that can take forward the agenda and position where investment and action should be focused. It's aimed at a wide set of audiences, including governments at all levels, including international agencies, the non-government sector, donors, funders, academics, and all interested parties. Something for everyone, and it speaks to the roles that all can play. How did we develop it? Well, following usual consensus processes, lots of global consultation, online, in person at the Congress, via the booth, via social media, and of course much debate. What did we produce? A much longer document, 12 to 14 pages that got cut to around 8 and then ended up at 4. You can see from this slide nearly every word was scrutinized, starting with the title, and went through to the full stop on the last page. But it was scrutinized with great integrity to improve and sharpen the intent of it, the messages and the opportunity it could present to multiple audiences in multiple sectors, health and beyond health. What did we end up with? I've already mentioned a sharp 4-pager, really 3 pages of content. The first page is the preamble, which I've indicated on this slide is about reinforcing and reinforcing the importance of physical activity, somewhat neglected risk factor in the agenda to date, with some disappointing level of progress in terms of changes in levels, but of course policy development and implementation. A reinforcement of the links to many multiple agendas, like the Decade of Nutrition, like the Urban Health Agenda, the New Urban Agenda from Habitat 3, and of course Ending Childhood Obesity, to name just some of those relevant synergies. It then leads into the substantive part where new material, new angles, new arguments are presented, where physical activity and action on increasing levels of physical activity through behavioural change, through population-based approaches, can link to and help achieve the 8 of the SDGs. And you can see a nice graphic there which might be a very useful resource for many on this call, which captures the 8 SDGs which are tied to and related with physical activity actions across the health, of course, number 3, education 4, gender equity 5, inequalities 10, sustainable cities 11, climate change, land use, and equalities. So we've got a lot of opportunities to link with 8 SDGs, and the substance on this page is explaining how does action on physical activity, and I'll come to that. The last page is about the opportunities we have for collaboration, the need we have to increase efforts, increase investments. They're presented partly as barriers, but of course turned to present them as opportunities. Looking at least one of those in more detail, and I've chosen SDG 11 as one of great relevance at the moment, and that is how action to increase physical activity through walking and cycling, investment in the appropriate infrastructure, creating safe, welcoming public open spaces for walking, cycling, recreation, can deliver not only physical activity, but of course help to achieve the other listed SDG targets. I chose on this one because of course it has another synergy, and that's with the Shanghai Declaration, and many would be familiar with the presentation and conference that took place in late November of last year, hosted by WHO. A focus on urban health, a focus on looking at those social determinants and upstream that shape health. So here's an example where it at least creates the link between why we should be working with the other sectors beyond and outside of health to share combined resources, join agendas to increase the environment, and how it can help physical activity. Each of the other areas I've mentioned are outlined in a somewhat level of detail as this. The 6 challenges or opportunities, some will be very familiar with you, but I draw your attention to them because they do set a template for where we need to invest our actions and efforts. We've got to renew the commitments. There simply is insufficient action on physical activity to enable us to achieve the 2025 goals, and therefore miss opportunities of achieving the SDG goals by 2030. We need the intersectoral, multi-sector, and the coordination. That's true for NCDs, but it's also particularly true for physical activity. And we know feedback from countries is saying that this is one of the barriers. So I invite the conversation and discussion after this call to think about how efforts and synergies can work to improving and sharing resources and skills in multi-sectoral engagement. That we need to build the human resources and the workforce capabilities is again common across SDGs, but particularly true here. And you can read the remainder of the opportunities here in terms of technical assistance. The sharing of successes is something we just are not doing enough of, and we can learn from tobacco and other areas where policy, legislative, program experience is being shared, but we haven't quite got the mechanisms yet inside of government or outside, and certainly across globally, to have maximize this opportunity. Strengthening monitoring surveillance is underpinning, and of course supporting the research and evidence base. So there's certainly plenty to do and plenty of opportunities for all the stakeholders to get involved. These remain the barriers to progress and therefore the opportunities and needs for us to work on collectively together. What now with the Bangkok Declaration launched in November? Well, this slide alerts you to the forthcoming translated versions. We're delighted to report on the opportunities we've been presented with to translate, and they'll be going online. I think a previous slide showed you how to get in touch and source both the English and the forthcoming international, and I invite more welcome, and I'll link you now to the last dot point where ISPA, along with Thai Health, are going to continue to work with a dissemination strategy. So please get in contact with the contact person, Trevor Shilton, or the ISPA Association with those emails. Of course, we want collaboration with all on this call around the endorsement of that Bangkok Declaration and the use of it in advocacy efforts. And these will be forthcoming, and welcome your involvement with it. Where does the Bangkok Declaration sit from the perspective of global advocacy? Well, from ISPA, and I'm speaking largely to date on from a perspective of the ISPA Society, it's a third of a series of useful advocacy tools, again available from the ISPA website for those not familiar with it. But I think the landmark contribution it makes at this point is its link with the wider agenda, and it's seeking to endorse and encourage that cross-sector collaboration. I want to finish this section by acknowledging the substantial contribution of the hosts, Thai Health, the Ministry of Health, Ministry of Public Health, the Governor of Bangkok, and of course all those involved with the ISPA Society and the Congress that made that Bangkok Declaration and are carrying forward the actions of it now. Where does it fit in the bigger picture? Well, if you just glance at this slide, you can see the history here. Some early work in '96, a lot of work from WHO in 2004 to 2010, but somewhat patchy. And then there's an absence of any physical activity, specific documents or plans that will help countries and others deliver on the ambitions of promoting physical activity and achieving the active lifestyles. And that's why, if I move to my last section, and that is the opportunity that's been presented by the development at the recent Executive Board. So in January, the Executive Board met, and an agenda item was proposed by Thailand to call for a physical activity action plan to address one of those barriers, and that is the failure to implement what we know we need to do, and the targeted interventions. So it was passed at the Executive Board, so it's very, very fresh news. And right now it follows, I mentioned it was presented by Thailand, and it follows the development and leadership taking place in the Southeast Asia region and other regions to further their efforts, support countries to implement more on physical activity. It's an opportunity to extend the work at WHO. Now I'm based here. I can draw your attention to the last dot points, which really enable us now through this request to start to focus on providing more specifications on what and how the actions to implement to make a difference. And it aligns very nicely with work plans that were already in train, which include the Global Physical Activity Toolkit, the updating of the Physical Activity Guidelines. If you noticed earlier, they were 2010. It's now 2017. We urgently need more guidelines on sedentary behavior as well as under 5s and early years. And there's some work underway in updating estimates. So the opportunity now to present the Physical Activity Action Plan will really add to a suite of initiatives that are underway here at WHO, and of course in partnership with many others, including the regional offices and the country offices. The timelines are to deliver this draft action plan to the Executive Board of January 2018 for the World Health Assembly of May 2018, which boils down to approximately a 10-month process to have the paperwork and submissions. So you can anticipate that there will be outlining of a process over the next 10 to 12 months to engage all interested parties in a process that will seek to maximize this action plan and provide a template for countries. It's a real opportunity to fill a gap. We've had for a long while the global level and now more recently national policies. But what I think many on this call and certainly the discussions at the ISPA conference is the failure to actually move from action to implementation, from policy to implementation. So this is an excellent opportunity which we're looking forward to embarking on. It's so fresh that the development process has not yet been put into place, but I'm sure you'll be hearing more from us about that process, and I've been delighted being able to provide you a window of this in this call. So thank you very much.
Fantastic. Thanks, Fiona, for that really comprehensive presentation. It's really exciting to see the rise of physical activity onto obviously the health and NCD agenda, but also really linking into the Sustainable Development Goals as well through the Bangkok Declaration particularly. I've got a couple of questions, and there are a couple of more questions coming through the chat facility. I guess just one question immediately that springs to mind in terms of the process for the action plan on physical activity. You mentioned obviously that it's going to be a 10-month process. Do you have any kind of idea yet of how civil society will be able to get involved in the development of that action plan?
I fully anticipate that there'll be the standard processes for the consultation. The exact specifics of those across the regions and the dates of those are still to be negotiated and planned internally, and then of course communicated. But like other consultations where both member states and then civil society are involved, they will certainly be on our agenda.
Fantastic, thanks. And obviously we see many different global action plans going through WHO on many different issues. What do you think we can do from a civil society perspective to be pushing to make sure that this particular action plan on physical activity has teeth and has impact at the national level?
A very good question, one which I think we all need to reflect on. The last thing I think we all want is another document that doesn't provide the right levers and provide the information that's needed by those at the coalface and on the ground trying to implement. So I think the opportunity here that we're exploring in the very early stage is the synergies between the implementation or action plan and the resources that I just mentioned, which can then fuel and support the development of the human capacities in terms of capabilities and skills to implement the guidelines which can help develop the recommendations which countries need as underpinning policy, and then of course the actual interventions. I think critical assessment of the content, bringing experiences from what's worked elsewhere and what lessons we can learn from other areas would be a valuable role that we look forward to having your input on.
Great, thanks Fiona. We've got a question come from Karen Milton, one of your colleagues at ISPA. She asks, is 10 months sufficient time to be getting the plan right?
That's another good question. It's shaped by the requirements and the opportunity that's presented, but it was requested that this is taken to the World Health Assembly of 2018. And without getting into too much detail, but the governance processes will require that paperwork is submitted by October, ready for translation to get to the January Executive Board. So it's tight, but I think we're ready to respond. This has been somewhat a long time waiting if you go back to my timeline scale. So I think we will just need to hit the ground running, as the expression is, seize the opportunities over the middle of this year to deliver on that timeline.
Great, thanks. We've also got a good question from David Patterson from IDLO. Was there much discussion in Bangkok of legal and regulatory frameworks which can promote physical activity? Any legal capacity building required?
In Bangkok, I may not be able to say fully. I'm sure there were conversations, but I thank David for that question because it's of particular relevance that we need to push and pull the field towards the opportunities and needs of the legislative interventions. So for physical activity, I would say, unlike the area of nutrition where there's much work underway, we need to start developing, indeed even starting with exploring what are the legislative and frameworks that are needed, the opportunities and levers within the regulatory area, and then we could start positioning. So I'd say it's very early days, David, and others are interested, but there is great interest for collaborations to build this field, to explore the options, to test them, and then take those effective ones forward. Very much like some other areas of nutrition which are beginning to push those boundaries. Time to start for physical activity.
Great. We've got one final question from Laurent Hubert. Has WHO reached out to potential funders who could help facilitate civil society engagement in the process?
Not yet. I think my earlier remark about how new this is, we've just literally getting the final paperwork from the governing bodies of the record of the meetings. So it's early days for any action reaching out. I'm conscious of that in this call. There's a lovely opportunity to provide you with a preview of the plans. Reaching out to collaborate will be a priority. The funding situation is not positive here and globally at the moment. Many countries would endorse that. So we do need to look for the potential of donors, potential of partnerships to seed all aspects of the development and of course implementation of this. So we welcome further conversations on that.
Thanks, Fiona. And then John Klein from NCD Child is asking, will this plan fit into the Sustainable Development Goal accountability, or will it have its own kind of accountability framework towards WHO?
Another good question. I'll defer that one as is perhaps a little unclear for me from both what is the intended plans of this and whether it would be better to fit into the SDG or to have its own in addition. Of course, the primary accountability from this technical unit is to deliver on the achieving of the 2025 goals, but the integration into the SDG framework and accountability would be one on a horizon to look into. So ask me in a few weeks.
Great. Okay, thanks very much, Fiona. I think we're going to have to move on to the next agenda item, but thanks very much for being with us and presenting on the physical activity side of things. Just a reminder to everybody that all of the slides will be available after the webinar on our website, as well as a recording of the webinar. And please feel free to put your questions into the chat facility as we go, and then I'll come back to the questions after each set of presentations. So thanks very much, Fiona.
Thank you.
Okay, let's move on to the next presentation, which is from Alena Matzke from the NCD Alliance to talk us through the broader week of the WHO Executive Board and key outcomes from the week. Over to you, Alena.
Thank you, Katie. And before I'm going to launch into an overview of this exceptionally long executive board, I'm going to ask everybody to stand up at their desks. I know that some people in our audience, such as WHO colleagues, are already doing so. So take a minute or so to stand up, stretch. I'm sure your brain will work even better after that, as I'm going to start with just a very quick overview of the agenda in case some of you have forgotten the agenda of the board already. Next slide, please. Next slide, please. Thank you. So I'm not gonna spend too much time on these two first slides. Just a quick reminder where you can find all of the EB documents, including some of the resolutions and some of the decisions that were adopted at the board. I've also included a link to the NCD Alliance coverage of discussions and also link to NCD Alliance briefings and statements. So I'm going to start us off with the address of the Director General, then move on to a quick overview of what happened around the election of the Director General, then moving on to NCDs, then health systems, and then promoting health throughout the life course, the WHO program budget. Next slide, please. Both 2016 and 2017, as well as 2018-2019. scale of assessments, and also management and governance and staffing matters. Sorry, next slide, please. And next slide, please. Thank you. So the first point I'm going to gloss over is the opening address delivered by Dr. Margaret Chan, which included quite a bit of interest from an NCD's perspective. The Director General reiterated the importance of implementation of economic policies to effectively reduce tobacco use, noting the clarity of evidence to support action. And she was referring here, of course, to the report on economics of tobacco and tobacco control released earlier this year by the U.S. National Cancer Institute and the World Health Organization. This report discusses the current evidence base surrounding the economics of tobacco control and concludes that evidence-based tobacco control interventions make sense from an economic as well as public health standpoint. So she spent quite a lot of time in her opening address, which is unusual, talking about NCDs. She also called for courage when addressing what she calls the powerful economic operators, which are key drivers of NCDs, and added here that we will never make sufficient progress against lifestyle-related NCDs if we fail to accept this responsibility. So very strong words here from here. She also mentioned the growing burden of NCDs as reported in a WHO task report, which documents the steep rise in risk factors of NCDs in the African and drew attention to the threat of air pollution to health, saying that 92% of the world's population lives in places where air pollution levels exceed WHO limits. Next slide, please. And before I proceed, can I kindly ask everybody on this call to mute themselves who are not speaking? Thank you. All right, so almost two full days of mostly closed-door sessions at the EB were spent on the election of the Director General, but the nomination of the final 3 candidates, which is one of the reasons that this executive board was very long, more than 1 week long. And there were 2 rounds of votes. In the first one, the Ethiopian candidate Tedros came in first, followed by Dr. Bestreo and Dr. Nishtar. And in the second round, Tedros again took the first place, followed by Sonia Nishtar and then David Nabarro. And so these, in the second round, was the one that determined the last 3 final candidates, which now be put forward to the WHA in May for election. And it's quite interesting to know that at the executive board, it was up to the 34 members of the board to make these nominations through these 2 rounds of screenings and interviews and votes. And at the WHA, it is up to the 194 member states of the WHO to then elect the Director General, who will take office on July 1st. Next slide, please. Right. So moving on to the actual agenda items, beginning with the agenda item on NCDs. Member states here focused predominantly on the updated Appendix 3 of the WHO Global NCD Action Plan, the preparations for the 2018 UN High-Level Meeting on NCDs, and also the proposed approach to register contributions from non-state actors. Several governments emphasized that the 2018 high-level meeting was a top priority for their government and also spoke out in support for the preparation for the UN high-level meeting, but there wasn't much in terms of detailed guidance on the preparatory process that was provided by member states to the Secretariat. Most member states endorsed Appendix 3 and said that they were quite happy with the updates to the appendix in their statements. However, Canada, the US, and New Zealand requested a specific technical briefing on Appendix 3 and the WHO choice modeling analysis that was used to update Appendix 3 to take place well ahead of the World Health Assembly in May. And in response to this request for a technical briefing, a reference to the endorsement of Appendix 3 and the resolution that the board then proposed for adoption at the WHA was bracketed. And there's quite an interesting development here to note, which is that following the executive board discussions on Appendix 3, which in the section on unhealthy diets contains reference to sugary drinks taxes, but has a little note there saying that WHO choice modeling analysis hasn't been completed yet, and which was noted by a couple of member states who then called for a technical briefing ahead of the WHA and conditional to the endorsement of Appendix 3. And after the executive board, there was some rumors going around spread by industry or originating from an industry website saying that WHO had vetoed sugar tax endorsement, and this is obviously not true. And these rumors were, for example, used in South Africa, which is currently debating the introduction of a 20% tax on sugary drinks, but WHO stepped in right away and refuted these rumors. But just to note, interesting development. And overall, several member states, in particular low and middle income countries, mentioned the challenge of industry interference extending beyond tobacco to also alcohol and food and beverage as an obstacle to successful national responses. But and a large number of low and middle income countries also highlighted the extremely critical importance of international technical systems in order to accelerate national responses. With regards to the proposed approach to register contributions from non-state actors to the achievement of the global NCD targets, several member states spoke out and said that they wish to see this report further refined and that it was more important to them that the register was based on a sound approach rather than rushed through and agreed in a rushed manner. Next slide, please. So just to recap, the resolution that is going to WHA on NCDs will hopefully endorse the updated Appendix 3. You see it's still in brackets here, and we'll have to watch the discussions on the Appendix 3 ahead and during the WHA. It will note the GCM-NCD work plan for the period 2018-19. It urges member states to implement their international commitments and to support the preparations for the UN high-level meeting in 2018 at the national, regional, and global levels. And hopefully here we'll also see a number of member states step forward at the WHA to announce that they'll be helping to host these meetings. Will definitely be an intended outcome from an NCD Alliance perspective here. And the resolution requests the WHO Director General to submit a report on the preparation for the 2018 high-level meeting to the WHA in 2018. So this report would summarize what has happened at the regional preparatory meetings, the discussions at the regional preparatory meetings, and any recommendations that made at these meetings. Next slide, please. Moving on to the Global Action Plan on Dementia, member states welcomed the action plan in their interventions and focused on the importance of human rights perspective, the importance to reduce stigma associated with dementia and to maintain the dignity of people living with the condition, to support family caregivers, and to increase investment into research to find a cure and to improve care. The board recommended to the World Health Assembly to adopt a decision which endorses the Global Action Plan it urges member states to develop ambitious national responses to the overall implementation of the Global Action Plan, and also requests the WHO Director General to submit progress reports in 2020, 2023, and 2026. Just a quick note that all of the hyperlinks on these slides can be accessed in the slides that will be sent around after the webinar. You can't click on them on the screen, but they will be active in the slides that we'll share following the webinar. Next slide, please. The next item I'm going to cover are the discussions on the draft implementation plan on ending childhood obesity. Overall, member states welcomed the plan, and several member states highlighted the importance of regulatory and population-based approaches to curb the obesity epidemics, including restrictions on marketing, front-of-pack labeling, and taxation of unhealthy commodities. You may remember that the draft plan was made available very late, and given that the plan was published so late, the sense that I got was that a lot of member states had wished to have more time to review the plan and didn't feel sufficiently prepared to discuss the plan at the executive board. And for example, the U.S. requested additional opportunities to review the plan ahead of its endorsement at the 70th World Health Assembly. There's also a few member states, and I recall in particular Sweden and Japan, who spoke to the need to have a stronger monitoring and evaluation framework attached to the plan, which is certainly a position that we as NCD Alliance and other partners we work with share. No concrete indication of next steps was given by the Secretariat at the Executive Board itself, but I think it's safe to assume that further work will be done on the draft plan, taking into account comments provided by member states. I'm sure some member states will submit written comments, and so I'm sure we'll see slight changes or bigger changes to the draft plan between now and the World Health Assembly. We'll certainly keep you updated on this one. Next slide, please. Another topic that caused a lot of discussions at the EBU was a proposed resolution on cancer prevention and control. There was overall very strong support for this draft resolution and its role in supporting national implementation of cancer plans and the elevation of funding for prevention and control as a priority for many member states. There was a drafting group that was set up during the executive board, made up of 20 member states and coordinated by Canada. And this drafting group developed a revised text of the resolution on which most of the text was actually agreed. However, the sort of outstanding points were related to the access to essential cancer medicine. So between now and May, we'll see more consultations on this resolution, and then which will hopefully then be adopted at the WHA. If any of the people on the call are interested in more information on this topic, I encourage you to reach out to our colleagues at the UICC, and if you wish a particular contact right now, I'll ask my colleagues to share the email address of the advocacy manager of the UICC, Rebecca Martin-Doherty, through the chat feature. So if anybody wants that contact, please type it in our chat here, and we'll respond to you and connect you there. Next slide, please. As Fiona already covered, there are a couple of additional agenda items. One on physical activity. I'm not going to spend more time on this, as Fiona has already updated us sufficiently on this. Another addition, or another somewhat of a surprise, was a discussion around rheumatic heart disease. And the board decided that RHD will be included on the agenda of the 41st session of the Executive Board, which will take place in May, right after the World Health Assembly. And this decision really comes in response to very extensive advocacy done by the RHD community, led by RHD Action, calling for a coordinated global response to RHD. So congratulations to our colleagues working on rheumatic heart disease. And discussions are set to revolve around the adoption of a resolution to mandate WHO to address RHD on a global scale. We'll definitely be watching out for discussions on this on RHD at the Executive Board in May. Next slide, please. Moving on to health systems. Our first agenda item here is human resources for health. The board noted a report here and also adopted a decision which is to finalize and submit a 5-year action plan to support the implementation of the recommendations of the High-Level Commission on Health, Employment and Economic Growth at the 70th World Health Assembly, and also to work with member states to adopt measures focusing on the key recommendations of the report of the High-Level Commission, including the development of intersectoral plans and investment in transformative education and job creation in the health and social sectors, and which will benefit from the international mobility of health workers. Next slide, please. Then you also may remember that there was some, or that we all probably, at least I wondered, and I'm sure some of you did, wonder whether the Executive Board would address the UN High-Level Panel report on access to medicines, and member states found a way to voice their views on the recommendations by the UN High-Level Panel under the agenda item 8.3, addressing the global shortage of medicines and vaccines. A couple of positions to highlight here. The government of the United States of America did not welcome consideration of the report by WHO governing bodies and spoke out strongly against this happening. Then many developing countries, on the other hand, felt that while not all recommendations of the report should be followed, the report should at least be considered by WHO governing bodies. And Netherlands, also welcoming a discussion of the report's recommendations, announced that they will host the first WHO Forum on Fair Pricing to take place on the 10th and 11th of May. In response to the calls for a standalone agenda item on access to medicines at the upcoming World Health Assembly, the board then decided to expand the existing agenda item 14.3, which is the corresponding agenda item to 8.3 of the EB, to addressing the global shortage of and access to medicines and vaccines. And to follow through, in accordance with that, the Secretariat will provide a new document under this agenda item to cover both the shortage of and access to medicines. And if you want a bit more detail on the Executive Board discussions on the UN High-Level Panel report, later on you'll find a link here that guides you to an article written by IP Watch, which is very detailed and quite helpful to read. Next slide, please. 8.7, promoting the health of migrants. The board noted the report that was provided to the board, and member states in their statements emphasized the importance of promoting the health of migrants in light of overarching priorities of the right to health and to leave no one behind, and also noted the particular vulnerabilities of migrants and refugees to both physical and mental conditions. Member states called on WHO to continue collaboration with the ILO, but also the UNHCR, in particular as related to a global compact on refugees and on the and on the Global Compact for Safe, Orderly, and Regular Migration. The Secretariat also noted with particular things the interventions of member states would emphasize the importance to consider mental health of migrants and refugees, and reiterated the underlying importance of efforts towards broader health system strengthening and the attainment of universal health coverage in order to maximize preparedness in the context of migration. Next slide, please. So discussions on 11.1, implementation of the 2030 agenda, was rather short. We noted the report that was provided emphasizing the importance of integration of health into wider sustainable development priorities, underlining that health is a prerequisite for sustainable development. SDGs should not be seen as an add-on to WHO work, but really should shape the existing work of WHO, and also noting here the fundamental role of multi-sectoral action. The Secretariat responded noting the importance not only of building better health systems, but also really building better systems for health. So I guess the discourse here has shifted significantly through the adoption of the 2030 agenda. Next slide, please. Role of the health sector in international chemicals management. The EB noted the report and considered the draft roadmap, which is due to be finalized for adoption by the World Health Assembly. In their interventions, member states highlighted the need to promote rigorous scientific assessment of both hazardous chemicals, including endocrine active chemicals and certain pesticides, and safe alternatives, and really calls for the promotion of the use of safe alternatives here. Multiple member states also expressed concern that illegal chemicals are still present in many markets and frequently in use, and reiterated the importance of stringent regulation to remedy this. And challenges were noted, not surprisingly, to be especially great in developing countries where obviously regulations are much weaker in capacity to regulate is very weak. The Secretariat requested any final suggested edits to the draft roadmap to be shared by mid-February, so we'll see an improved roadmap published ahead of the WHA. Next slide, please. The global strategy on women's, children's, and adolescents' health. In the discussions here, member states highlighted the triple dividend of investing in adolescent health, including improved access to services, positive impact on health later in life, and intergenerational impact on the next generation. Also, again, perhaps not surprisingly, given the global political context right now, the issue of safe abortions was highlighted and mentioned by a number of member states. Challenges of data collection due to lack of strong CRVS systems were highlighted, and the Secretariat responded saying that they may not be able to provide data for all 60 indicators of the monitoring framework, which is attached to the global strategy, and that it also hopes to include the issue of palliative care in the report from the high-level working group for the health and human rights of women, children, and adolescents' health. Next slide, please. I'm going to spend a short moment here on the WHO program budget. We usually don't talk all that much about financial matters as they pertain to the WHO, but it's obviously a rather important discussion to follow. So starting here with both the discussions on the program budget 2017 and 2018-2019, the current base programs of WHO are only financed by 88%, and there's a financing gap that remains of $404 million, which is significant. And the main challenges here are, or remain really, the earmarking of voluntary contributions and the substantial decrease in overall level of flexible funding available to the WHO, which is only there's been a 30% reduction in core voluntary contributions over the years. In the discussions at the Program Budget and Administration Committee, the PBAC, which took place ahead of the Executive Board from the 18th to the 20th of January, and the Executive Board itself suggested that greater prioritization was needed, and perhaps even identification of activities that should be wound down or closed. Several member states called for an improvement in voluntary financing, and this could include imposing rules on voluntary contributions, such as a limit to the degree of earmarking that is available to member states. And I also noted that there was a comment by a or several member states, I can't recall, that called for consideration of reallocation of resources, such as for polio to NCDs, for example. In addition to efforts to really try and broaden the donor base and to mobilize additional funding, the Secretariat is, however, planning for eventualities, such as freezing or delaying recruitment, cutting resources for travel and meetings, and also postponing activities to make up for the gap in the current program budget financing. Next slide, please. You may also have heard of a proposal to increase the scale of assessments for 2018-2019, and this comes in response to the really quite significant threat to the long-term sustainability of the WHO and the recommendation of the high-level panel on the global response to health crises. So the Director General has proposed an increase of 10% or $93 million in assessed contributions. And just to, as a reminder, assessed contributions are the membership dues paid by countries in order to be part of the WHO, and the amount of each member state fee is calculated relative to the country's wealth and population. And these assessed contributions are a key source of financing for WHO and allow for a certain level of predictability in funding. However, as I said on the slide before, they have declined as an overall percentage of the program budget for several years and account for less than 1/4 of the organization's financing currently. In the discussions on this, several member states supported the proposed 10% increase in assessed contributions, while others were not in a position to support the proposal, at least not at this time. And as an outcome, the Secretariat and member states will continue informal discussions on the proposed program budget until mid-February, and then the Secretariat will revise and complete the proposal for submission to member states by early April to allow for sufficient time for review ahead of the WHA. Moving on to my last slide. The board noted a report which provides an overview of the implementation of the framework of engagement with non-state actors via the WHO regional offices, and in a decision item admitted into official relations, I believe 5 organizations: the Bill and Melinda Gates Foundation, Grand Challenges, Canada International Rescue Committee, Knowledge Ecology International, and the Fred Halls Foundation. And as you may have heard, there was quite a bit of controversy about the admission of the Bill and Melinda Gates Foundation into official relations with the WHO. Several health and public interest NGOs expressed their strong concerns over admitting the foundation because of the foundation's trust investments in business ventures such as Coca-Cola, for example, which is obviously interesting from an NCD perspective. And if you're interested in reading up more on here, there's a lot of detail to consider. I've included a link here for you to follow. finally, also the Executive Board noted a list of criteria and principles for secondment from NGOs, from foundations, and academic institutions, which was called for by the WHA last year. Was an outstanding item for the Secretariat to finish. Next slide, please. Just a reminder, the provisional agenda for the World Health Assembly is already out and can be found among the documents for the EB. The dates for the World Health Assembly are the 22nd to the 31st of May. As always, the assembly takes place at the UN Palais des Nations in Geneva. And also just in terms of planning ahead and travel, similar to what happened at the January Executive Board, it is fair to assume that that this WHA will be longer than usual, and that the election of the WHO Director General may push back the discussion of other agenda items, so that we may see this spilling over into the second week of the WHA, just as happened at the Executive Board. And then the 141st session of the WHO Executive Board will take place following the WHA from the 1st to the 2nd of June at WHO headquarters. And that is all for me. Thank you very much for your attention. I look forward to your questions.
Thanks, Alena. That was a great deal of information for everybody, and I really recommend everybody goes back to the slides if you have a chance, so that you can kind of revisit the different agenda items that Alena just walked us all through. So we've got a couple of questions that have come through, Alena. So the first one is around the DG elections, not surprising. Deanna Vakamagi at American Heart Association is asking, any idea which countries or political blocs voted for who in terms of the DG elections?
That's an interesting one. Diana, it's extremely difficult for me to say anything in detail. I think a lot of it, I think there are a few people who may be in a better place to give more detailed prediction. The voting is secret, and it also will be secret at WHA, and the governments are extremely tight-lipped on this subject. Definitely, geography plays into this. Even I think some people were a bit surprised by the election results, but then I find it rather relative. There's several people who say that David Navarro's campaign may pick up and see a boost in the coming months, given that the two other European candidates have been were eliminated. But yeah, I think I would kind of make things up right now if I were going to say anything more in detail. It's really, really difficult to say more about this, given the secrecy around this process. All of the sessions, or almost all of the sessions, were closed door. So yeah.
Yeah, very, very difficult one to answer. I agree. I mean, I think just from my perspective as well, I think it's clear that obviously geography did have an impact in some ways, as well as many other different considerations in terms of the candidates. I mean, interesting to see that the 6 original candidates, you had 4 Europeans, and in the end, in the 3, we've only got 1. And there's obviously many different factors and considerations at play behind this all as well. And Alena, do we know that I remember hearing about a graduate institute event coming up with the 3 remaining candidates? Is that right?
Ooh, I don't know. It's very possible though.
Oh, okay. Yeah, I think it's in March. I don't have the date in front of me, but we can share that around to the network as well.
Yeah, I wouldn't.
Yeah, exactly. Because the Graduate Institute did an event together with the Chatham House before December. And our colleague Johanna Ralston has just said that it's on the 6th of March. That's right, at the Graduate Institute.
Oh, yeah,
great.
Thanks,
Johanna.
Great.
Okay, and then let's go to, just a question around the World Health Assembly as well. So you mentioned that the agenda is already up. which is good to see. And as you said, obviously the DG elections are going to be all-encompassing. Kind of, how do you see it kind of panning out? Obviously, from different policy issues, trying to get any discussion with governments around policy issues. Is it going to be as tricky as it was for the EB week?
Do you mean in terms of bilateral conversations or the discussions that take the official discussions?
I mean, just getting interest for specific policy issues, because during the EB it was obviously very, very difficult. It just felt like the whole thing was dominated by the politics around the DG elections. It was very difficult to get traction on anything, really.
I do think that the DG election will dominate for sure. However, similar to I think what happened then once that segment of the agenda was over, I think that governments are obviously still interested in all of the other issues. It's just that I think until the elections will be finished, I think that will be their main focus, and then once that's over, we'll kind of go back to the content, if that makes sense.
Yeah. Yeah. Great. And then just a question around, obviously the whole financing of the World Health Organization is, a long-standing challenge and an issue. Do we know how NCDs fared in terms of the new program, the new budget?
So NCDs are one of the. Do you mean in terms of the gap, or?
Yeah, just in terms of
overall,
how
Yeah. So overall, the of greatest concern is the WHO emergency program and NCDs basically. And WHO emergencies and AMR and antimicrobial resistance were added to the upcoming program budget, which actually is one of the reasons why the next program budget is slightly larger. So there hasn't been kind of an overall increase, but it's just that these two items were added. But in terms of the part of the program budget that is consistently underfunded, that's definitely NCDs. And there's quite a lot of fear, I think, also connected to, for example, the announcement of the possibility of smaller U.S. funding if the new President Trump goes through with his announcement to cut international funding, and that would obviously severely impact on the WHO, with the U.S. being one of its largest funders in terms of member states, and that would certainly also affect NCDs quite a bit.
Mm-hmm. Great, thanks. And just linking back also to the discussion on NCDs that took place at the EB, obviously, this EB and WHA is the real kind of beginning of the process and the lead up to the 2018 high-level meeting, which Priya will be talking to us about in a moment. You mentioned that there was very little discussion by member states on the process. Was there any kind of key governments, calling for anything in particular, or any kind of substantive comments around the 2018 meeting?
There was a lot of support for the meeting and also the preparatory process, but there was no announcement of a member state being, yes, we will host one of the regional meetings, or any particular guidance given to the Secretariat on how the process would look like. So it was rather general statements, and I think this shows us that as the NCD community ahead of the WHA, both when we talk to governments in capital, but also when we talk to the delegations at the World Health Assembly, really raising the importance of the preparatory process of the UN high-level meeting is quite important. And as I said during my presentation, ideally we would like to see more clarity around when regional preparatory meetings could happen, which member states will be helping to host these meetings, etc.
Mm-hmm. Great. Thank you very much, Alena, for that really detailed presentation. And just to remind everybody again, slides available on our website, and also on the Executive Board, we've got a detailed overview of outcomes of the Executive Board on our website, which you can download in PDF form as well. Thanks very much, Alena. Let's move on to our last speaker, which is Priya Kanayson from the NCD Alliance based in New York. Priya will talk us through both the preparations for the UN high-level meeting on NCDs in 2018 and then swiftly go through to the CSW and the high-level political forum. Priya, over to you.
Thanks very much, Katie. So I will get right into it. There's quite a lot to get through. Next slide, please. So this is just a sort of a brief overview of where we are right now. So the HLM high-level meeting in 2018 will be the third high-level meeting on NCDs held at the UN. The first in 2011 resulted in a political declaration in which governments acknowledged the need to address NCDs and set forth 4 time-bound commitments to achieve progress towards the prevention and control of NCDs. The second was a high-level review in 2014, and it reviewed progress towards implementing those 4 time-bound commitments that were made in 2011. And one of the main differences between these two meetings was the level of attendance. In 2011, it was world leaders, heads of state, heads of government, and in 2014, it was very much at the ministerial level. Another difference in 2014, the outcome document, while renewing government's commitment to addressing NCDs, there was also a very strong focus on implementation of targets and time-bound commitments at the national level. So in 2014, the outcome document also called for a high-level meeting in 2018 to assess progress towards achieving the commitments, and now that is fast approaching. Next slide, please. One of the things to keep in mind as we prepare for this HLM in 2018 is the shifting landscape in which we're working. So this year we have a new UN Secretary General, a new Deputy Secretary General, new partnerships in the Secretary General's office. We will have a new Director General at the WHO in May, and we also have, for the first time, a WHO NCD Ambassador, Michael Bloomberg. Additionally, we have a new global policy landscape. We're working with the 2030 Agenda for Sustainable Development, which of course includes NCDs. We have the Addis Ababa Action Agenda on Financing for Development, which recognizes the dual benefits of tobacco taxes. And we will find ourselves at the midpoint for the 2025 global NCD targets. Next slide, please. So keeping all that in mind, we can sort of go into some of the preparations for the 2018 HLM. And this slide we can thank our WHO colleagues for, and it outlines the 4 components of the preparatory process for the HLM. So the first is a formal process that was mandated by the 2014 outcome document. And this is the WHO Director General's report on progress towards the commitments of NCDs and just achieving NCD commitments and national targets. And this will be submitted to the UN General Assembly for discussion in fall of 2017, and it will be a report with recommendations. Secondly, there will be an evaluation of the Global Action Plan and of the GCM, Global Coordinating Mechanism, on NCDs as part of an informal process. Both of these reports will also include recommendations for the 2018 high-level meeting. There will also be an informal component of the process, but a very important one, intergovernmental process under the auspices of WHO. And this will be the regional preparatory processes in the 6 WHO regions. And this will be held after the WHO Director General progress report is submitted in the fall, so most likely between October 2017 and spring of 2018. And the exact dates of those are still to be decided. And out of all of these regional consultations, which will most likely include a multi-stakeholder component, will come reports with recommendations, again, for the HLM. Under discussion is also a potential second ministerial conference on NCDs, which would result in a declaration if it were to take place. And finally, really the meat of what part of this process, the formal process, is an intergovernmental process, which will be convened by the President of the UN General Assembly, and they will appoint 2 co-facilitators to really guide this process. So member states will first negotiate the modalities resolution for the 2018 HLM, which will include things such as the level of participation, the length of the meeting, and the timing. The co-facilitators will also convene an informal dialogue with non-state actors and then produce a zero draft of the outcome document, which will be the basis of member state negotiations. And this will all take place in the first half of 2018. Next slide, please. So a little bit more detail on the WHO DG progress report. As I said, it was mandated by the UN General Assembly in the 2014 outcome document. This will be submitted to the UNGA, the General Assembly, by September of 2017, and will then be discussed by UNGA in October. So that's the discrepancies in dates you see there. The outline contains the 7 components you see there, so outcomes, progress, and process, progress in realizing commitments, the 4 time-bound national commitments, international cooperation, recommendations, and then also include the WHO NCD Progress Monitor, which will be coming out in the fall of this year as well. Next slide, please. So I realize there are quite a few dates sort of around in the air, so here really concretely puts down what the process is. As I said, in fall of this year, the WHO DG will submit the progress report on NCDs to UNGA, who will then discuss the report in October, November, and regional preparatory meetings will begin after the WHO DG report is submitted. These will continue until March, spring of 2018. And the modalities resolution, negotiations, and adoption of that will happen in early 2018. After the modalities are adopted, then negotiations in the outcome document can take place, and that will happen most likely between April and June 2018. Depending on the modalities resolution, we will then know when the HLM will be and whether it will be in June or September of 2018. Next slide, please. So given what we know of the official preparatory process and our experience in 2014, NCDA has developed several priorities for the process as we see it leading up to 2018. Of course, one of our main priorities is that there are regional preparatory meetings in all WHO regions, and that these should be multi-sectoral and multi-stakeholder. That these should be held early enough in advance to prepare governments and define regional priorities as input to the process and outcome negotiations. Next, we also prioritize convening a UN civil society task force as the official mechanism through which civil society provides input. So civil society task force are a standard part of the preparatory process for high-level meetings, and they also help determine the format, theme, and program of civil society hearings and help identify speakers and general participation of civil society during the HLM. With that, we are calling for an interactive civil society hearing no later than 2 months prior to the UN HLM, and this is because the outcome document is usually closed before it is adopted, and so we want to make sure that any recommendations that come out of the civil society hearing can be taken into consideration and incorporated into the final outcome document of the meeting. Next slide, please. One of the other things that we learned in 2014 when attendance was at the ministerial level was that while this is good, we don't want to create a precedent that the high-level meeting on NCDs is for ministers only. So we are calling for participation of member states at the highest level, so heads of state and government. And we know that 2018 is an important midway point to achieving our 2025 targets, and its participation at the highest level is really crucial to get that leadership and global momentum for the success of the HLM and the NCD targets that we have set forth. We also are calling for the HLM to be held in September of 2018, just prior to the UN General Assembly, and that's really to help ensure that participation will be at the highest level, since many heads of state and government are already in New York for the UNGA in September, holding the HLM just prior to that for a minimum of 2 days would be ideal. And finally, concluding the HLM with an action-oriented outcome document. Again, this is not legally binding, but an outcome document is the strongest possible agreement within the UN for international cooperation. And we are calling for an action-oriented outcome document with time-bound commitments and targets to ensure accountability and monitoring of progress, as well as the necessary resources attached to accelerate action. Next slide. So, of course, one of the biggest questions for the NCD community and NCD advocates is what would success look like at the end of this lengthy process? Of course, for us, from a process perspective, it would be having these regional preparatory meetings with full engagement of civil society, the UN Civil Society Task Force CSO hearing, civil society hearing, action-oriented outcome document, etc. And one of the challenges with which we are working for 2018 is that there is actually 3 high-level meetings planned for 2018 in addition to NCDs. There will be one on antimicrobial resistance and one on tuberculosis. And so there is a chance, and there is a call from some member states, that all 3 of these high-level meetings be held back-to-back prior to UNGA in September, which would mean that each HLM would most likely have 1 day for discussions. So that is something that is yet to be decided and discussed, but it's something to be aware of and one of the big challenges. In terms of outcomes, what commitments do we want to see from member states, new mandates for WHO and the UN, different agencies such as the task force, and where are the gaps in the response? And of course, in terms of engagement, a strong presence of heads of state and heads of government, and really trying to bring in non-NCD, non-traditional NCD actors, so looking at development, those beyond health from climate change, etc., and a huge focus on people living with NCDs and those affected to be part of this discussion and this process. Next slide, please. So this is a general vision and a summary, a high-level summary of our strategy for the HLM preparations. We are now in the midst of advocacy on the process and also beginning to reach out to key stakeholders and potential high-level champions. So this year's World Health Assembly will really serve as a kickoff for a detailed policy and outcome asks consultations, and we'll be launching a consultation with all stakeholders in May. And we are looking towards the second Global NCD Alliance Forum in Sharjah this December, really as a strategizing meeting in addition to bringing together all of civil society and stakeholders to discuss how we can position NCDs and our strategy looking towards the HLM. Next slide. I think we could pause here for questions or just move into the next and do questions at the end.
Yeah, why don't you carry on through, Priya, and then we'll take Q&A at the end.
Okay, so moving into the Commission on the Status of Women. Next slide, please. So the Commission on the Status of Women, CSW, is the principal global intergovernmental body dedicated to the promotion of gender equality and the empowerment of women. This year, CSW will be held in New York from the 13th to 24th of March under the theme Women's Economic Empowerment in the Changing World of Work. And under that, the review theme is Challenges and Achievements in Achieving the MDGs for Girls and Women. CSW consists of a ministerial segment from the 13th to the 15th of March, which will consist of high-level panels, interactive dialogues, and of course general discussion. The provisional agenda and program of work are both available online. You won't be able to click on it from the webinar, but when we share the slides afterwards, those links will be live. At the end of its 2-week session, the Commission will adopt a report on its work and also decide action on several draft resolutions. Next slide, please. So one of the questions that might come to mind is, why is this session important for NCD advocates, especially when the theme doesn't seem to address health? And really one of the main things is that it helps demonstrate the natural links between the RM and CAH, so reproductive maternal, newborn, child and adolescent health and NCD agendas, and how NCDs impact women's economic potential and the economic potential of the family and the population as a whole. This really pulls in from the Global Strategy for Women's, Children's and Adolescents Health, which recognizes the need to address NCDs throughout the life course under its Survive and Transform pillars. And it also highlights the need for and success of integrated RMNCH and NCD services and programs. Next slide, please. So the detailed official program of side events has yet to be posted online, but there will be actually several side events on NCDs during CSW. I've listed here 2 of the side events that NCD Alliance is co-hosting. The first on Wednesday, the 15th of March, with the Mission of Denmark, Women Deliver Management Sciences for Health in Novo Nordisk, on delivering an integrated NCD response for all. And the second on Thursday, the 16th of March, on women and NCDs and looking at the debunking myths and life course approach. The WHO GCM on NCDs is also hosting an event on Tuesday, the 21st of March, highlighting the recommendations of their working group on integration of RMNCH and NCDs and a life course approach to health. And we know that there will also be several events on nutrition and on mental health, and given the refugee crisis and humanitarian settings. Next slide, please. So I'll move directly into preparations for the high-level political forum. Next slide. The High-Level Political Forum, or the HLPF, is the main review body and mechanism of the 2030 Agenda for Sustainable Development and is held under the auspices of the Economic and Social Council. So the HLPF reviews progress towards and challenges in achieving the SDGs. And to do this, member states, as agreed in the 2030 Agenda, are encouraged to present voluntary national reviews which aim to facilitate the sharing of experiences in implementing the SDGs. So this year, 43 countries will present their national reviews, and these countries are geographically representative. So you have countries such as Argentina and Ethiopia, to Denmark and India. The full list is available online, and as each country submits documents for its national review, the site is updated. So this year's HLPF will be held from the 10th to 19th of July in New York, with the ministerial segment taking place from the 17th to the 19th. And again, the segment will include high-level panels and interactive dialogue. Next slide, please. Member states agreed that in order to allow for in-depth discussion on each SDGs during the 2030 Agenda negotiations, that the HLPF would focus on a specific theme each year, allowing for more in-depth discussion on a subset of goals. So this year, the theme is eradicating poverty and promoting prosperity in a changing world, under which goals 1, 2, 3, 5, 9, and 14 will be reviewed. Goal 17 on partnerships is to be discussed every year, as it is an essential component of achieving all of the goals. So this year's HLPF is particularly relevant for NCD advocates, since not only will SDG 3 on health be reviewed, but so will SDG 2 on nutrition. The HLPF really enables advocates to continue the momentum from the adoption of the agenda and ensure NCDs and health more broadly are part of the development conversation. And from our perspective, building a strong presence at the HLPF this year will help cement NCDs as part of this development conversation and help governments and other stakeholders recognize that the NCD community, NCD advocates are engaged in the 2030 Agenda follow-up and review. And I think this will become more and more important as we look to following years when SDG 3 is not specifically under review. And I think our job then will really be to make the links between NCDs and health and the other goals whose outputs have a significant impact on the risk factors for developing an NCD, such as Goal 13 on climate change, those on sustainable urbanization, et cetera. One of the challenges, of course, is that NCD advocates and civil society may not be at the forefront of organizations called upon to input into countries' national reviews. In many governments, the Ministry of Foreign Affairs or Development is responsible for compiling national reviews. So one task for NCD civil society is to find out who in their government is conducting the process and how to get involved so that NCDs and health are included. Next slide, please. One clear way for civil society to be involved in this HLPF preparatory process is during regional preparatory meetings that will be held in the following months prior to July. These meetings will be held in the 5 Economic and Social Commission regions. So the first in Asia Pacific, the Asia Pacific region in Bangkok in March. The second, the European Regional Forum in Geneva in April. The third, Latin American and the Caribbean Forum in the end of April in Mexico City. The fourth, the African Regional Forum in May. And then finally, the Western Asian Regional Forum in May. Both of those last two in locations to be determined. And actually, if you click on, when we share the slides later, if you click on each of those boxes, more information about participation is included. So many of these meetings include a multi-sectoral, multi-stakeholder component during which civil society will be able to input and make statements, and that is an opportunity, as we see it, to make sure that NCDs and health are part of the recommendations that come out of these meetings and that are then submitted to the HLPF in July. So more information forthcoming as it is posted online. And that is it for me, so happy to answer any questions.
Thanks a lot, Priya. Lots of really useful information in there on 2018 meeting, on CSW, and on the High-Level Political Forum. I have a mention from Lena at WHO, who says that the WHO Nutrition for Health and Development Department are organising an event on the 20th of March on the margins of CSW as well at 1:15. And the title of the event will be Women in Labour, a Nutritional Perspective, co-hosted by Argentina and Sri Lanka. So another one for people's diaries if you're heading to New York for CSW this year. Priya, a couple of quick questions because we're slightly over time. So you mentioned the regional preparatory process in the lead up to the High-Level Political Forum. What are we expecting in terms of kind of outcomes from those regional meetings and how they will feed into the final High-Level Political Forum in July?
Sure. So each of these meetings are expected, each of the regional meetings are expected to put together a document of recommendations in terms of some of the successes and challenges towards implementing the SDGs in the region. So I believe the idea is that many of the recommendations will pull from the national reviews and sort of what has been compiled at the national level. And then the regional meetings are really a forum for discussion between the different countries and an opportunity for civil society from different countries and other stakeholders to come together and discuss prior to the HLPF and put in some recommendations for how progress can be accelerated in the region.
Great. And I think you raised a really important point around making sure that the NCD community is involved in the way that governments are developing their voluntary national reviews, because as you say, development community are going to be front and centre of government's minds in terms of talking to development civil society organisations and developing their voluntary national reviews. And I think the NCD community is going to have to be very proactive in being able to get around the table to be providing data and evidence of progress on NCD prevention and control that will then be used in countries' voluntary national reviews. So really good point there. In terms of the 2018 UN high-level meeting, obviously, as you say, this year is the beginning of the process. It all gets started, although obviously the main focus this year will be around the process, and then next year will be much more the kind of meaty elements around outcomes and negotiations in New York. What do you think civil society organisations and advocates can be doing now in their countries in the lead up to the 2018 meeting?
Great, thanks. I think definitely the earlier we start discussing with governments, the better, so that this is on everyone's radar in terms of 2018 might feel like a very long time away, but in fact the process is going to move rather quickly. So I think the sooner we begin having the introductory meetings to the process priorities, we can share our priorities and our asks in terms of the process and making sure that governments are in tune to what civil society is asking for, the better, especially as we move towards the modalities resolution and have governments primed for what civil society is asking in terms of length of the meeting and level of participation.
Great, thanks, Priya. And just another little promotion that we will be shortly putting on our website those process priorities for the 2018 high-level meeting. We've produced a kind of two-pager that we're using in our advocacy towards governments and the WHO and lots of other partners. So we'll be putting that on our website for everybody to download shortly, which is our process priorities. And as Priya said in her presentation, lots of opportunities for our network to be getting involved in the NCD Alliance's own preparations for 2018, particularly when we start getting to consultations around the outcomes. What do we actually want governments to be agreeing to and committing to? And we'll be holding a whole series of online consultations in the lead up to that. Great, thanks very much, Priya. And so that leads us to the end of our webinar. So let me thank all of the speakers, Fiona, Alena, and Priya, for the excellent presentations. Quick reminder that the slides and the recording will be available on our website for you to download and listen to afterwards. And thank you, everybody, for joining. We'll be holding our next webinar in the next 6 weeks or so. Thanks, everybody. Goodbye.
Thank you for joining today's webinar. You may now disconnect your lines.